Esperança is the Portuguese word for hope. Hope, an aspiration, a longing, a dream of something better. Esperanza is also the name of a global health organization that has been transforming lives in some of the poorest communities in the world for the last 50 years. Here is the thing. Hope isn't an end unto itself. It is a vehicle that drives lasting change. Hope is where the journey begins, with the needs and desires of real people in individual communities struggling to achieve optimal health, clean water, secure housing, and nutritious food. Esperanza believes that healthy families make for healthy communities. Whether it's through their volunteer surgeon program in Peru or their dental hygiene program in some of Phoenix's schools, it all leads to a healthier world.
Thank you, Sam. It's so good to see you again. We met Sam Waterston when Esperanza was featured as part of the PBS Visionaries documentary series. That show kicked off the start of our 50th year of service, and we welcome you to our 50th anniversary celebration. I'm Jerry Royce, President and CEO of Esperanza. We've whipped up a fabulous event for you, and we are so happy to have you join us. I love to cook. The more interesting the ingredients, the better. You should have received your pre-event package with the whisk and the beautiful Esperanza cookbook. The cookbook includes some amazing recipes from the countries where we serve. If you didn't get one, please put your name in the chat box and we will be sure to send you one in the next few days. We invite you to continue the celebration when you try out one of these healthy and delicious dishes and share your creations with us using hashtag #EsperanzaTurns50. And don't forget to share pictures of your celebrations going on right now wherever you are using hashtag #EsperanzaTurns50. During our time together, we will be sharing with you what's cooking at Esperanza and the ingredients that contribute to who we are and the work that we do. I believe it's a dollop of the past, a heaping serving of the present, and a careful measure of the future. And let's not forget another very important ingredient, our generous donors, including those of you who are with us today. Without you, none of this would be possible, and we appreciate you. We are also grateful for our founders, the Tupper family, our passionate volunteers, and the partners we serve alongside. In the early years of the work that began in Brazil at the mouth of the Amazon River in 1970, over 150,000 children were inoculated from diseases, and thousands of lives were saved through prevention education and the very first of Esperanza's volunteer surgical missions. Let's hear from Sue Tupper Johnson as she recalls the famous launch of our floating hospital, the Esperanza.
I especially remember the old ferry boat in Point Loma, California that my mom's brother, Tom Woodruff, located and found. Esperanza paid $15,000 for this old ferry boat and refurbished it into one operating room, 2 clinic rooms, a pharmacy, and crew quarters so that Luke could start traveling along the Amazon with his medical facilities on board. Everything that was done on the boat was done with donated labor and materials and old parts from the USS Bunker Hill. When the boat was finally done, we took 4 large Greyhound buses from Phoenix. It was full of staff, volunteers, friends, and my dad's guitar mass group from our church to San Diego to christen the boat.
Thank you, Sue. It was indeed the many committed volunteers and donors that helped build a strong foundation for our continued work. and continued, we did. The work in Brazil evolved into building a medical clinic and medical school. More lives were saved and transformed because of Esperanza Brazil, which operates as an independent organization today, managed by a team of empowered local staff and in true Esperanza form, focusing on long-term sustainability. Let's take a moment to honor someone who played a key role in our early work in Brazil. This individual was indeed instrumental in building the foundation of hope on which our organization stands today. He served as medical director of Esperanza from 1979 to 1994, where he oversaw the work of 40 employees, the hospital boat, and a dozen medical outposts in remote villages. More than 1,000 patients per month received care in the clinic, and medical and other students received critical training. He is a genuine advocate for the underserved and continues to inspire the next generation of health and medical professionals as an educator at the VA Medical Center in Phoenix. It is my honor to present the first inaugural Esperanza Legacy Award to Bill Dolan for his exceptional years of service and commitment to serving the poor and vulnerable.
Thank you so much. I am deeply honored. Esperanza has done so much for so many over the years. I had the privilege of spending the first 15 years of my surgery practice with Esperanza in Latin America, including 6 years in the Amazon of Brazil. Back in the 1970s, 1980s, Esperanza did so much ahead of everyone else in terms of prevention, public health, immunizations, clean water, breastfeeding. They all made a huge difference. We also brought in the surgical teams from all over the United States, volunteer surgical teams, nurses, surgeons, anesthesiologists, pay their way down, and they will work very hard for our poor inhabitants of the Esperanza Clinic. I can still remember, often for the elderly, cataract surgery. Take the patch off the next day, a blind person can see. We had many of the children with a severe cleft lip and deformity, congenital deformity. 1 hour in the operating room, they had a new face. And I'll never forget one woman who said in Portuguese, she saw her new child come out, meu Deus, milagre. My God, it's a miracle. So these are the kinds of things that Esperanza has been doing and continues to do for so many of those in need. It's a tremendous honor to have worked with Esperanza. The goal is to make a difference for many, many more. Bring hope to those in need. Esperanza.
Thank you, Bill. We are forever grateful for your compassion, kindness, and desire to serve those in need. So just like with any great recipe passed down, each generation tweaks and perfects the recipe for the next. Over the years, Esperanza's staff and boards have worked hard to improve and perfect our recipe for hope. Joining us now is immediate past board chair, Dr. Marty Johnson, to share how he got involved with Esperanza.
When I started my practice in the early 1980s here in Phoenix, I had heard about plastic surgeons, for instance, Ted Dodenhoff, who had gone down to the Amazon and actually were on the boat performing cleft lip and palate surgery. About 2012, I had stopped working. I had some health issues. And once I started feeling better, I was looking, what could I do? And I decided to get a master's in public health. So I did that through the Johns Hopkins Bloomberg School of Public Health in Baltimore. And that's where Esperanza came into my life. I did the internship, did a program in Nicaragua. And I like to say that, while I was there, that's where I drank the Kool-Aid. The work of Esperanza differs now from the early years. In Brazil, initially began by distributing vaccines for polio and typhoid, smallpox, and more. And by the end of our time in Brazil, that team had vaccinated over 150,000 local residents. Esperanza moved on and expanded to other countries that we are serving today: Bolivia, Nicaragua, Peru, Ecuador, and Mozambique. This was made possible through close partnerships with indigenous NGOs, non-government organizations, in each country. And we are able to stay in tune with the needs of the community, parachuting in and offering services that they don't need and didn't ask for is not sustainable. By doing this, we are able to give them what they need rather than what we think that they need. So our headquarters is located right here in Phoenix, and back in 2000, the board knew that we had to provide help to our community. When they looked at the disparity, it covered all population. The young people, there was a tremendous need for dental health. We had the third worst rate of cavities in the country right around our capital. When we get to middle age, we get to what we call diabesity, this epidemic, and anything we could do to provide nutrition training and health education related to nutrition was going to be hugely important. And more recently, we have now taken that to our elderly patients and clientele so that we can help them. Something as simple as being able to read a food label is so important so that they are going to make a nutritious choice rather than an easy choice. As a board member and the immediate past board chair, I think that I am most proud of the professionalism of our staff, the development of our staff, the enthusiasm of our staff. And we also want to say that because of the hard work of the board, we have been able to provide financial stability that I think is going to carry us in the future. For anyone who has been a part of Esperanza's 50-year history, I would like to just say, first of all, thank you for all of your time, all of your talent, all of your effort, your service, your support. I know that most of you have been like me, where my first mission to Nicaragua, I like to say that I drank the Kool-Aid. That's where I fell in love with Esperanza. And it was Kool-Aid we were drinking, so to speak, not the Tonias down there. But again, just thank you to all the volunteers, to the donors, to anybody who has been a part of Esperanza's wonderful 50-year history. Thank you very much.
Thank you, Marty. Having served with you for the past 2 years, I'm grateful for your steady hand and compassionate leadership. In a world that is ever-changing, it comes as no surprise that Esperanza continues to change as well. As Marty mentioned, our programs have grown and the number of people we serve each year along with them. One of our biggest areas of growth has been the expansion of our health equity work domestically as well as internationally. Our Phoenix program started 20 years ago with one staff member. And that same staff member, Maria Valenzuela, our domestic program director, has nurtured and grown the program to a staff of 5, offering health, nutrition, and disease prevention education, as well as providing other needed resources for low-income Latino adults, children, and seniors, serving more than 3,000 people each year. Our work in Phoenix is well established in the community, and our team is well respected for providing our expertise in health education and cultural competencies. All of our work in Phoenix is a mixture or combination of strong partnerships with other community organizations, community centers, HUD housing complexes, medical clinics, and school districts. Julia is one of our many participants whose life has been impacted by Esperanza. And she is followed by Dr. Lupita Hightower, Superintendent of Tolleson Elementary, one of our partnering Title I school districts.
Antes de conocer a este grupo de Esperanza, mi vida era, pues no tenía control en la comida, no sabía las calorías, no sabía qué cantidad, no sabía leer las etiquetas de la comida, no sabía tampoco qué tan riesgoso era todo lo del diabetes, qué consecuencias tenía, pues en la salud de mis hijos, en la de mi esposo, en la mía, no sabía qué tan riesgoso era no medir las comidas. Era un descontrol. Yo me enteré por medio de la escuela de mis hijos, pero gracias a una gran persona que es nuestra coordinadora Evelyn Alvarado, que siempre nos ha motivado y nos ha ayudado a tener nuevas metas y a luchar. Mi vida ha cambiado mucho porque yo pesaba 189 libras y ahorita peso 166 libras, que fue un gran cambio. Las clases me motivaron mucho. Estar activa en mi casa, en la comida, en el ejercicio, yo y mis hijos. Ahora sí ya mido porciones, me voy a la tienda, me fijo en las etiquetas, sé agarrar comida más saludable, menos carne y más vegetales y más frutas. No tenía un control y ahora que estoy tomando las clases ya no es difícil porque mi cuerpo ya se acostumbró a las cantidades que debe de comer y ahorita ya no es difícil. Yo le doy gracias a este grupo de Esperanza y a todos los que ayudan y nos traen las clases, que muchas gracias, que mi vida ha cambiado, tanto en mi salud como en físico, en mi alimentación. Gracias.
We chose to work with Esperanza because how can you not? They have been amazing partners. They are offering so many wonderful services to our families, like how to eat healthy. As Latinos, sometimes we don't eat the healthiest, so they have this class called Salud con Sabor Latino. It's an incredible class for our families, and they are able to have a huge impact on that. We are so grateful to Esperanza's support, and we wish them always the best. Thank you.
Thank you, Julia and Lupita, for sharing your experience and what the work of Esperanza means to you. Recognizing the need to expand our programs to provide services to seniors 3 years ago, we were blessed to have received a very generous grant from the Virginia Piper Foundation to begin our senior program, which is in full swing, seeing upwards of 120 seniors per month. As you can imagine, COVID-19 has had a dramatic impact on our organization. But thanks to the resiliency and, quite frankly, tenacity of our dedicated staff, almost overnight, we were pivoting quickly to continue our service to the community. Enjoy this clip of our early response to the COVID pandemic.
I'm Jerry Royce, President and CEO of Esperanza, and today we're gathered at one of the Cesar Chavez Foundation HUD housing to deliver food to our most vulnerable population. Because we were not able to meet in person, we decided that the money that we would have used to feed participants at our breakfast can be used to feed this very vulnerable population. These are all seniors. They really can't gather together right now. They can't get out of their house safely, and they lack the money and resources to do the kind of shopping and stockpiling that we're all being asked to do. So being able to take money that we were using to essentially feed our donors and feed our recipients, feed our community, is the best possible outcome for a time like today. So we've just finished our deliveries. We have happy residents, happy catering workers, happy Esperanza employees, because we're getting out into the community to do what we do best, and that is serve others. And my message to you is to do the same. Now is the time for us to come together, be supportive of one another, and do what we can to not social distance, but to physically distance. Stay in contact, be in touch with your loved ones, reach out to your friends.
Our most impactful experience working with Esperanza has been their support in helping our uninsured residents obtain medical equipment and supplies that they cannot afford due to health inequalities, like the lack of health insurance. Esperanza are doing an amazing job right now in helping us with food donations, fresh products, and cleaning supplies for all our community centers.
Thank you, Liz. Our partnership with Cesar Chavez Foundation is one important ingredient, and we greatly value the work we are accomplishing together. Like all great chefs, Sometimes you have to make a substitute for an ingredient you can't find or don't have access to in order to complete your recipe. When social distancing protocols meant that we were unable to serve our community face-to-face, we had to quickly adapt, and technology became our new best friend. Whether that be through virtual events like this one, or serving our participants through virtual classes, we are delivering health education through Zoom and instructional videos on a wide variety of topics to continue this vital preventative care. Our Phoenix program is making a tremendous impact on thousands of families who have learned to live healthier lives. The recipient of our second Esperanza Legacy Award is a champion for our domestic program. She has been a generous donor for 31 years, served on the board of directors from 2012 to 2019, and is a dedicated advocate for improving the health and well-being of Latino families across the Valley. Please join me in congratulating Mary Jacobs.
It is my privilege and honor to receive this wonderful recognition from Esperanza. It has been a privilege to me through the years to work with Maria and the entire Esperanza staff. We have had so much fun together with my grandchildren and the people at Esperanza doing the Christmas Angels. For years, we would shop for the children, wrap their gifts, enjoy the Christmas get-togethers with Santa, and to see the joy on everyone's face was just brought more joy to us, I think, or as much joy as it gave the children and their families. Through the years, we did the backpacks, stuffed with all kinds of good school supplies. That went into hygiene bags where we focused on toothbrushes, toothpaste, all the dental supplies. The children, my grandchildren, got involved in their schools, collecting these items, collecting gently used shoes, warm jackets, whatever the children needed. It helped them to get their community service hours. So through the years, it's certainly been a pleasure for our family to be involved with Esperanza. And again, thank you for this wonderful recognition.
Mary, we are honored to have your continued support of Esperanza and are so very grateful for all your years of service. One of my most impactful experiences with Esperanza was my trip to Peru in October 2018 and experiencing firsthand our international program in action. I traveled to the very top of the Andes Mountains to visit the Quiros Housing Project and deep in the valley of Abancay to participate in an ophthalmology surgical mission. Seeing the work of the people we served was transformational. And this experience was just a tiny sliver of all the amazing work happening across the 5 countries we serve, including Nicaragua, Bolivia, Ecuador, and Mozambique. The heart of our international program is our strong staff, led by Ana Ortiz, International Program Director, and our partner organizations in each of these countries. They are our hands and feet doing the work that meets the needs of their communities. And despite the setbacks and hardships they've experienced since COVID-19, they too are resilient and have made the necessary changes to be safe while continuing to serve. Let's take a look at a community development project in Peru and hear from the executive director of our partner, CADEP, Carmen Alvarez Ponce de Leon.
Siempre está bajando el agua, en año está bajando. Por eso hemos hecho nosotros reforestación acá al este, al lado del ojo del agua está reforestado ya. Ese es para mantener el agua, ¿no? El agua es importancia para todos, es consumo humano para nosotros. Sin agua no se puede vivir nosotros. Es para planta y para nosotros y para los animales.
Para el CADEP, el partenariado, el partnership que mantenemos con Fundación Esperanza es muy importante. A través de ellos y gracias a ellos es que estamos pudiendo atender a la población más vulnerable, población que no tiene recursos económicos, población que está sufriendo mucho los temas de cambio climático, está sufriendo mucho la presencia de empresas mineras que están vulnerando sus derechos, están vulnerando sus modos de vida, sus estilos de vida, y es a través de Esperanza que podemos implementar proyectos para llegar a esa población que de otra manera no tendría cómo mejorar sus modos de vida.
Antes de CADEF, cuando no estaba acá, estábamos desorganizados, no estábamos más capacitados del agua, cómo utilizar, y también así verduras no teníamos mucho. Ahora como nos ha dado alfalfa, así también tenemos alfalfa para el cuy. También verdura también nos ha dado, entonces ya sabemos cómo plantar, eso también nos ha capacitado. El agua más que todo se preocupa del agua, por eso hay veces nos da en tubos, también así accesorios nos ha dado para arreglar, ¿no? Donde se reventa el tubo, ¿no?
Esto son cadifa, ayudaba tengo. Chaywañan kay planta kuna pescachan verde, chaywañan trabaja chayco. Ñawpaqta manan tanto chayna mana uno kaqtinqa manan allintachu llank'ay pescara. Ripullo paskunanqa unuwanqa hatunkunatan kush. Chay paskaqqa llantaq wawakunapaq allin wiñananpaq. Y hinallataq anemiapaq kan q'umirchakunaqa lipin q'umirpas mas que todo wiñananpaq y anemiapaq ayna kan. Chaykunata ruwallaykutaq riki. Y naturalmente mana nuqayku ruwaykuchu abunuwanchu. Natural ruwakuyku chayta apakuykutaq wakinta mercadoma y mikhunaykupaq kan wawayku mikhuchinaykupaq manaña plazamantañachu rantimuyku. Antes no había ni agua, ni así no han crecido verduras, pero ahora siempre hay agua ya. Gracias, Esperanza, Uchtabaraj, Apachumayco, Allin, Yankaikunat.
In addition to the community development work, surgical missions have been an important component of our international program. Teams of surgeons and medical personnel travel to Ecuador and Peru, donating their services for a week to provide surgical intervention to those who do not have access or who can't afford it. Our missions have included gynecological, women's health, pediatrics, orthopedics, hands, ophthalmology, and of course, general medicine.
La historia de mi hijo. Mi hijo se llama Jeremy Ariel Mayas Pérez. Él tiene 14 años, vive conmigo, estudia, pero lamentablemente tiene un inconveniente en su rodilla. El problema de mi hijo en la rodilla es que él no puede extender, o sea, puede flexionar pero no extender. Se le ha ocasionado una malformación producto de una fractura, un golpe. Y le da molestia, le da problema, que quisiera correr con toda normalidad y eso no le permite, jugar pelota o hacer actividades que él no lo puede hacer con toda normalidad. ¿Cómo descubrí la organización Esperanza? Porque me llamaron de aquí del hospital de Becerra de Guayaquil. Ellos me hicieron la llamada y me avisaron que había una convocatoria el día domingo. Llegamos, me dieron rápido la cita con el doctor me evaluó al niño y fue algo rápido. Me dijo, Dios los ilumina al momento que están en un quirófano para cambiar la vida de tus hijos. Muy agradecida con los doctores, con el Hospital León Becerra por permitirnos a nosotros poder participar de este proyecto, poder ser parte de esta fundación que ayuda a mucha gente. No va a ser motivo de burla para nadie, va a mejorar su calidad de vida, va a poder trabajar con normalidad, estudiar con normalidad, hacer cosas que no hacía. va a tener su vida normal, va a poder compartir y reírse al igual que todos. Y van a mejorar la calidad de vida de sus niños, de todos los seres humanos a los cuales ellos meten su mano. La fue muy importante, muy agradecida con ellos, con los doctores, con el doctor Castillo, con el hospital, porque permite que este tipo de proyectos se lleve a cabo.
While the surgery itself transforms the life of the patient, as this video depicted, the impact on the rest of the family is indeed life-changing as well. This surgical work is made possible through the selfless and generous contributions of our surgical mission teams who donate their time, pay their own expenses, and bring all the supplies they need for the mission. This is truly a labor of love.
One of my favorite memories of my trip as a hand therapist down in Ecuador was when I had the opportunity to pass along great news to a mother of a 2-year-old who was born with both hands in positions that were completely non-functional. The mother was told prior to surgery that there was no guarantee that they'd be able to work on both hands, that she would have to choose which hand they should work on just in case. You could see the pain in her eyes when she realized that her dream of having a child with both hands that would be functional might not be realized. As a mom myself, it was heartbreaking to see. I speak Spanish, so Dr. Smith and Dr. Kozin, Dr. Katarinzik, they would ask me to speak directly to the patient or the family members. I had the awesome opportunity to run out of the operating room, find that mom in the waiting room, and let her know that her daughter was tolerating the surgery beautifully well and she was able to have both of her hands repaired. The mom wept and so did I.
We've shared about our past, highlighted our present, and now it's time to share our final ingredient, a bold vision for the future. We have a strong and proven foundation that gives us opportunities to develop programming throughout Arizona and to other states in order to serve additional vulnerable communities. Specifically, through our partnership with the Cesar Chavez Foundation, we will be expanding our services to Texas, New Mexico, and California, as well as El Mirage and Yuma. Internationally, we will expand our community development and surgical missions to include the Dominican Republic. And through local partnership, we are shipping donated medical supplies to Papua New Guinea and soon Venezuela. This strategic growth continues our mission to provide hope and improve health. And now, to share more about our future, it is my pleasure to introduce Misty Weishaw, Esperanza's board chair.
Thank you, Jerry, and thank you all for joining us today. Esperanza means hope, and I truly hope that you've been inspired by what you've heard today. I have served on many nonprofit boards and have never seen such a diverse, amazing, and committed group of donors, volunteers, community collaborators, board and staff that have assembled together, united in the same mission. I am so proud to be a part of history and to be part of a team that leads us into the future. As an organization, we face many challenges. There are a lot of disruptions and dynamic shifts taking place in the world right now that at times might seem difficult to navigate. But I see this as an opportunity for us to embrace our mission and provide hope. As Jerry said, it is time to take our ingredients for success and continue to find ways to bring the important work we do to more and more people. We need life-changing, empowering hope, now more than ever. And Esperanza stands ready to take on that challenge. World events are making the case for why a global health organization like Esperanza is fundamental to the healthy communities and how health inequalities in small, poor communities can have long-term global repercussions. Now is the time to lean in and embrace Esperanza's mission, provide hope, and meet the needs of communities we serve, while strategically expanding into additional communities of need. Each and every one of us plays a vital role in ensuring this happens. This cannot be done without commitment, leadership, knowledge, and resources. You are the key to our future. Throughout the next few years, I believe you will be the key ingredient to our recipe of success, which will move this organization to even greater heights so that it can provide hope for another 50 years. Help us create our future. Be a key ingredient in the recipe for health equity for all. To make a financial contribution to our work, you can text DOUGH, D-O-U-G-H, to 41444 and be directed to an online donation page. You can also visit our website, esperanza.org, for more information on volunteering for our programs. Again, text DOUGH, D-O-U-G-H, to 41444 or visit esperanza.org.
Thank you, Misty, for inspiring us about the future. And thank you for considering supporting our work. On behalf of our board of directors and staff, we thank you for joining us as we paid tribute to our past, honor our present, and set the course for our future.
Now please raise your glass and join us for a toast to the last 50 years and all those who made it possible.
Thank you for joining us.